Embryonic and fetal risk from radiation. Pregnant women may be exposed to radiation in many ways, such as from an external exposure, X-rays, gamma rays, and internal exposure when radioactive material gets inside the body by eating, drinking, breathing, or injection from certain medical procedures. The United States Nuclear Regulation Commission recommends total fetus exposure during pregnancy to be less than 0.05 gray. Gestation in humans is divided into 3 stages: pre-implantation, 0 to 9 days after conception; organogenesis, from 10 days post-conception to 12 weeks after conception; and the fetal stage, from 12 weeks to 40 weeks. According to CDC, radiation dose between 0.05 to 0.1 gray is considered inconclusive in terms of effect on the fetus. If the dose is above 0.1 gray, it is considered harmful to fetus. Fetuses are most sensitive to radiation during the first trimester, less in second trimester, and least in third trimester. Within the first trimester of pregnancy, the embryonic cells are extremely radiosensitive because the embryonic cells begin dividing, proliferating, and differentiating. An exposure greater than 0.1 gray may cause the death of the embryo during the first 2 weeks. During the first 12 weeks, an exposure above 0.2 gray may result in fetal death or severe congenital abnormalities such as growth restriction, intellectual disability, genital deformities, and sensory organ damage. Within second trimester, though fetal radiosensitivity decreases, radiation dose greater than 0.5 gray may result in adverse effects, including functional disorders, birth defect, and lower IQs. The mother could be showing signs of acute radiation syndrome. Within the third trimester, the birth defects are not likely to occur because the fetus is fully developed, only a slight high risk of having cancer later in life. Whenever a female patient of childbearing age 13 to 45 years old had an X-ray exam ordered, it is essential that the radiographer carefully question the patient regarding any possibility of pregnancy. A radiographer must be cautious and use the lowest amount of radiation necessary to make quality images when performing radiographic procedures on pregnant patients. Patients should let the doctor or the radiographer know if they are pregnant. Pregnant patients who are concerned about radiation exposure prior to their exams should be counseled.